Hello again and welcome to the last video in the short series of videos I've been doing talking about menopause and its symptoms. On today's episode, I'll be discussing the genitourinary symptoms of the menopause. So genitals, urinary system. So if we haven't yet met, like I say, my name is Dr. Stella and I am a family physician with a special interest in skin health in the UK. Don't worry, the skin videos are coming. But for today, I would like to finish what I started. If you haven't yet seen any of the previous videos, feel free to go through my Instagram page or check out my new YouTube channel where I've outlined them one after the other, if that's your vibe. Right, let's get into it. What are the symptoms that could affect women going through the menopause down there? So, number one, the commonest symptom is vaginal dryness and discomfort. So, menopause causes a drop in estrogen levels, and with a drop in estrogen levels, women get thinning and dryness and less elasticity of the vagina, and this causes dryness and irritation, and as a result a lot of women shy away from sexual activities because they find it rather uncomfortable. Secondly, there's a loss of libido. So the menopause not only causes a drop in estrogen, it also causes a drop in testosterone, which is quite important in libido. And because of this, most women lose interest in sex during the menopause. Thirdly, women can get recurrent urinary tract infections, which I would call UTIs going forward. So, as I already mentioned, the menopause causes thinness, dryness of the vaginal tissues. And what this means is that the bacteria that causes UTIs find it easier to ascend to the urethra and then into the bladder where they cause problems. And it's also been said that menopause causes changes in the structure of the urethra, and this makes it easier for the bacteria to get into the urethra and the bladder and cause infections. Lastly, people can get urinary incontinence. So this means that some women find that they suddenly leak urine when they cough, sneeze, or exercise. And this is because the drop in estrogen that happens in menopause causes changes to the pelvic floor, and that makes it easier for the pelvic floor to become weak. Now, what are the possible solutions? As always, I like to go from the conservative measures to the less conservative measures. A healthy lifestyle would always be helpful. So, in respect of the urinary symptoms, having a diet that's rich in fiber and water and less refined sugars would be gentler and more beneficial for your bladder overall, and exercise would also help. So, less sugar, more fiber means that your urinary health would be more robust and can withstand the effects of the menopause. And moving on from that, things like Kegel exercises also helps. Kegel exercises are exercises you do to help strengthen the pelvic floor, and doing that regularly can help strengthen your pelvic floor and make you less susceptible to urinary incontinence. Things like vaginal lubricants and moisturizers are highly recommended for vaginal dryness and discomfort. Water-based moisturizers or lubricants are preferred because they are less irritating to the vaginal tissues. I think examples include things like Yes, or I think Yes is a very popular one in the UK, but you can get them over the counter. You really don't need to consult a health professional about this. And lastly, if all these conservative measures fail, we can recommend vaginal estrogen therapy. So these are medications that can come in form of a gel, cream, or ring or patch that you put directly in the vagina that helps combat dryness and irritation. Most women find that when they use this, their vagina feels more comfortable, they get less urinary tract infections, and they enjoy sex more than they would have if they were not using it. So, and also, if you need it, your healthcare provider might suggest things like testosterone or HRT. However, I talk about the vaginal estrogen because some people would not go on HRT because they don't have the other symptoms or they're not much bothered by it, but are really bothered by the vaginal symptoms, and that could really be helpful, and it suits almost everyone. So to summarize all I've been talking about the last few weeks, menopause is an inevitable phase of life, and it comes with a variety of symptoms, but you don't have to suffer in silence. That's the take home. Even if you haven't taken anything away from all this talk, feel free to remember this, and also know that there are solutions out there, and that could be lifestyle changes or speaking to a professional or someone who's going through it, and get the help you need. For now, that's all from me. Till next time. Bye.